The case is a classical presentation for a patient with myelofibrosis. This is a 66-year-old gentleman that presented with fatigue, was found to have splenomegaly, and the lab test showed anemia, leukocytosis, elevated LDH, and on his physical exam, obviously had splenomegaly. So this is a classical presentation for patients with myelofibrosis. Myelofibrosis is a Philadelphia negative myeloproliferative neoplasm characterized really by, presence of constitutional symptoms, splenomegaly, cytopenias. It's one of the most symptomatic myeloproliferative diseases. The median age is usually 68, 70. So this really represents a classical presentation, although symptoms are not specific for the disease, but when we put all the information together, this really gears toward myelofibrosis. For the myelofibrosis diagnosis, one need to establish certain criteria. The bone marrow findings, including the presence of fibrosis. Fibrosis is not exclusive for myelofibrosis. It can be seen as reactive and in other malignancies. There are stages of myelofibrosis where fibrosis cannot be seen. We call that now prefibrotic myelofibrosis, but presence of megakaryocytic atypia, granulocytic hyperplasia, and fibrosis obviously are one of the criteria required for the diagnosis. One has to exclude other hematological diseases, namely CML, checking for BCR-ABL, and then establish some evidence of clonality by one of the phenotypic driver markers in myelofibrosis, such as the JAK2 mutation. There are minor criteria we look at, such as anemia, leukocytosis, presence of splenomegaly, and elevated LDH. So this patient had fibrosis in the bone marrow. He had a JAK2 mutation. He's anemic, has leukocytosis, splenomegaly, and LDH, and there is no evidence of other hematological disease. So he meets all the criteria for myelofibrosis. Sometimes, establishing the diagnosis could not be as straightforward. The fibrosis can be reactive. We have seen cases with lymphomas, hairy cell leukemia, connective tissue disease that patients present with fibrosis. Sometimes, as I mentioned, there is an early stage of myelofibrosis called prefibrotic myelofibrosis, where there is less than grade 2 fibrosis on the bone marrow, and that sometimes can be missed or diagnosed as essential thrombocythemia or other types of myeloproliferative disease, or completely missed.